So this is not a drug, but what is it categorized? Is it a supplement?
We make it under the Dietary and Supplement Act. We follow the GMP procedures. Our facility is GMP approved by our state as a nutritional manufacturing. It's not a drug manufacturing. It technically is in this gray area where the FDA says parts of it are drug, but it's not a drug. The Farms Bill says it's not. So it's still regulatory-wise in kind of this gray area. So the answer is yes. We're
To both.
To both. We can't make drug claims, but we can do studies and show you this data.
Paul?
I have a question.
Paul? Okay, go ahead. Go ahead.
The bioavailability studies,
Yes.
I know with Epidiolex, they make the patients take it with food to increase bioavailability up to like 60, 70% or something like that. If not, it's way lower. So with the way you process it, does it matter whether you take it with or without food? It won't change?
With or without food, it doesn't matter. Most people just put it right underneath their tongue, although we can't really tell them that because that's a drug delivery kind of mechanism, but most people just put it right underneath their tongue or in their mouth.
Okay, so it's not affected by food in the stomach?
No, because your food, you're going to change it into a micelle anyway. We just do it outside the body. So we haven't seen any big change. And I don't know, Fong has, you've been having a lot of patients on this, and Dr. Jayne, do you guys see any difference with food or?
I just have them use it with food if they complain of stomach upset after taking it.
And some of that might just be the flavors, and we use natural flavors and stuff, but some people may not like cinnamon or berry or mocha, so that can upset the stomach.
What's Med7's stance on vaping? Do you have innovations towards that? Are you guys thinking about it? Or are you guys staying away from it?
We're staying away from it because the bioavailability is the same just orally as it is with vaping. So there's no reason for us to do it. And if you put it in if you put our micellized product in a vape, it basically heats it up to, or vaporizes it at 400 degrees, and then you don't have a micelle anyway. So it'd be an expensive way. You'd just be taking a nanoparticle at that point, and it'd be a waste of money.
Good micelles.
Of good micelles, yeah. There's no need, is what we say.
I may have discussed it earlier, but have you guys observed the time to treatment effect? And how soon can I tell someone that they'll start to notice it?
You're talking about steady state, or are you talking about immediate response?
Immediate.
Immediately?
Someone coming in looking for relief.
For what?
Pain or anxiety or depression?
Just all anxiety, depression.
Yeah, in my experience, you know, the home run would be for everybody to have an immediate response that knocked it out of the park. In my experience, pain takes a little longer, anxiety, depression a little less. Excuse me. The sleep issue usually improves. Most of them probably within a week or 10 days. Some people sooner, some people longer. Some of the chronic pain may take 4 to 6 weeks of consistent use. But like I said, it truly is really cool to have something that you know isn't going to hurt the patient and works a majority of the time. And so, you know, he didn't talk about it, you know, specifically, that there's no upper limit. You know, if it was, you know, $35,000 worth to become toxic, anything less than that, if they can afford it. So, but I have some people that'll use it 3, 4, 5 times a day. And when they do, they get a better response than if they use it once a day. But some people don't need it more than once a day. And some people use it on a PRN basis, but I really think they if they let it get behind the 8 ball with their pain or their symptoms, it takes a little while for you to build it back up. So, but a 12-hour drug probably is going to take 5 days to hit steady state,
Yeah.
somewhere between 5 and 7 days to hit a steady state. And some problems are going to require a steady state to respond. But you have the latitude to let them try. Hand them the bottle and say, take this.
Thank you.
And we see people that on the anxiety, kind of they're taking it for the CNS effects, because it's so fast acting, they'll get a quicker response, but on the pain and inflammation, sometimes it takes quite a bit longer. Sleep, one note on sleep, it is not sedating.
It still helps you sleep.
But it's calming,
Yeah.
which is kind of a cool thing. I mean, I take it every night. I go right to sleep, but it's not sedating.
No, but you do get to deeper sleep.
But I get to deeper, and that's what we found in NIH study. We found that 91% of the patients reported more active dreaming. And just anecdotally, my wife takes it because she snores. No, she says I snore.
Yeah.
But I don't hear it myself. But anyway, interesting that she started taking it too, and for probably 10, 15 years in our marriage, I don't think I didn't have a dream. Maybe because my kids were small and I never got really any good sleep or uninterrupted sleep. But now it's like every morning we wake up, we start telling each other our dreams. Sometimes.
Depends on what they were. Yes.
Is it twice a day dosing recommended?
We once or twice a day. It depends. I take it once a day, but I think it depends. We have people that take it multiple times.
Yeah. Yeah, whatever works.
How many products do you have? You've got a topical and an oral?
We have 2 topicals, and then we have orals in multiple flavors.
Did you have a question?
Yes, so you mentioned very few, if no, interactions. Is there an instance where you can think of when you would not recommend it?
I assume if they tried it, had some sort of allergic type reaction.
Which makes sense.
Yeah, I mean, that's about it, but you wouldn't know that ahead of time. But if they had one, that would be it, or if they had some potential side effect that I couldn't explain, I would probably tell them not to use it. Okay. Just to be on the safe side. Yeah, Dave?
The slide talked about blood pressure reduction. Was that a quantified dose, or was that just an observation?
It was a single dose.
We didn't test blood pressure in our study. That was data from, I think it was University of Chicago. And so
Was it a 7.5 milligram dose, 50 milligram dose?
I don't know what they were even.
And the hard part with that is, I don't believe that was Med 7.
No, it wasn't.
Yeah, so it could be all over the map. But I do tend to see people's blood pressure drop. I've actually had a couple of patients, their intraocular pressures drop to where they could get off of the eye drops, the beta blocker eye drops. So, which is pretty significant.
What about the cost? What is the cost of this different product?
Well, like I always say, the most expensive product is the product that they won't take, right?
Leading to all the other problems.
Yeah, and so our cost of this is $129 for the 2-ounce bottle.
To the patient?
Pardon me?
To us, to the patient.
Oh, no, to the patient. You guys get it for $65.
And the small bottles?
And then the small bottles range, we have 2 other sizes, and they range from 79 to 49. So they're
On the retail.
on the retail side. So
And then the small bottles, how much they pay for those?
oh, they pay 49 and 79. So
No, I'm talking about the pharmacy.
and the pharmacist, it's Keystone, so it's half that cost.
What is the milligram strength of the?
Those are, you go like in the smaller ones, you're just basically going in half every time you go down. So the bigger one has, we express it in a matter of the whole full spectrum oil, so it's 3,375 milligrams, and then you're going down to 1,500 and 750
3,000 per 2-ounce bottle?
per 2-ounce bottle. Now the amount of CBD in there, just so you know, is about 225 in the big one. People say, well, that's not very much, but if you take that number and times it by the bioavailability, you're getting more of the equivalent dose of what everybody else is getting. So, like in this study, the amount people were taking for our NIH study was 2.5 mLs, or about 2.5 mLs, which is 10 milligrams. We saw all this results with 10. Most of our seizure patients, everybody are on like 2 to 3 mLs, which is everybody. The guys who do the big research, I met with a guy who did all the seizure research over in Europe, and they use about 150 to 250 milligrams a day for seizure patients. And I told him we were controlling him on 10 to 15, and he laughed at me. He said, there's no way you're doing that. But it's not about the milligrams on the label, it's what you're getting actually in the bloodstream.
Absorption, yeah. Are we done? All right.
Thank you, I hope you enjoyed
Thank
your
you very
day.
much.